I'm just going to what the point of this call is about.
Great. Thanks, Dwayne. Good morning, everyone. I'm Christina Shaklee. I'm the Workforce Coordinator here in the Office of Primary Care Access at DHMH. And today is National Health Service Corps Community Day. It's a national event, so I thought it would be fitting for me to do a webinar and provide some guidance around National Service Corps. As you can see, this is sort of a canned presentation, so I will be working off the slides, but then I'll be providing additional information as well. So, at the end, we will take questions. Dwayne, I don't know if you want to do questions during the presentation,
Sure.
but I was thinking we sort of just do them at the end, if that's okay.
We can do them at the end. Again, we do have the ability, if you have the Q&A within and you have a question that you want to go ahead and text or email, I can see that question, and I will say that at the end, and then we'll do all the questions at the end of the webinar. Okay?
Great. So thank you, everyone, for joining, and I will begin. So the National Service Corps has been around for a long time, and it builds healthy communities by supporting qualified health care providers dedicated to working in areas of the United States with limited access to care. So after this slide, we're going to go over a brief history. Dwayne, you can next slide. Sorry, Dwayne. So the National Service Corps was created in response to the healthcare crisis that really emerged in the United States in the 1950s and 60s when many retiring physicians left many areas of the country without medical services. And I think during that time there was also somewhat of a decline in people going to medical school as well. So as we move on, so in the 1970s, the National Service Corps was really created. Scholarships were starting to be given out during that time, and then in the 1980s, the loan repayment program was launched. So around 1989, they had a field strength of about 1,500 people, National Service Corps recipients. In the 90s, mental health disciplines were added to National Service Corps. And then as you can see now with the growth of the Affordable Care Act and more increased funding, there's over 10,000 providers that are National Service Corps recipients working in the United States. And in Maryland, we have about between 160 and 170. That number fluctuates sometimes, but we do get a significant portion of National Service Corps providers given our size. So going on with today for the National Service Corps, if we look at the field strength on the next slide.
Sure.
Sorry, Wayne. As you can see, the majority of the recipients are mental health providers and physicians. A majority of nurse practitioners and physicians assistants also apply, but the majority of the recipients of National Service Corps are really in those mental health fields and in the physician fields, the primary care physicians. So all these providers are working in health professional shortage areas in serving underserved communities. So it's really actually a great program, and that's why I really wanted to let you know more about the process and how you may be able to utilize this program. So just a couple fast facts. National Service Corps members are currently providing care to more than 10 million people. They offer networking and other educational resources to support NHSC providers during their service. And the number of providers in service has nearly tripled since 2008. And I will say from when ERA funds and the ACA funding came out, we saw a significant increase in not only National Service Corps site applications, but also providers utilizing National Service Corps. So the extra funding has really been great for this program. So there's 3 programs that I'm going to touch base on for the National Service Corps. I'm going to go most in depth with the National Service Corps Loan Repayment Program, which is the one we're going to talk about right now. The other 2 programs, the NHSC Scholarship Program and the NHSC Student to Service Loan Repayment Program, I'm going to touch on at the end. So the NHSC Loan Repayment Program really is for a broad range of provider types who work in a health professional shortage area. For providers working in a HPSA score of a 14 or above, full-time, they can receive up to $60,000 for 2 years. And as you can see across here, even providers that are working part-time for 2 or 4 years can still receive National Service Corps funding. Sites with a HPSA score of 0 to 13, they will get a little less reimbursement. And I will say, in all honesty, we can do, I can talk about health professional shortage area scores. If you're not familiar with them, I'm happy to, talk about them offline. But when you have a designation, you're given a health professional shortage area score. And I will say, if you don't have a score of a 14 or above, the chance that your provider will get loan repayment is very, very slim. On a HRSA call that I was on, a couple months ago, they said that last year they were only able to provide loan repayment to practitioners that were in a score of a 14 or above. So they do fund from high scores to low scores until they run out of money. So it doesn't necessarily mean that if you have a score of a 10 or 11 that your clinician won't get loan repayment, but it's I don't want to say that it's unlikely. It is a possibility, but it's better if this program's utilized with facilities that have a higher HPSA score, in all honesty. And I'm sure I will get questions about that at the end. So going on, to be eligible for the National Service Corps, the provider needs to be a U.S. citizen or national. They need to currently work or apply to work at a National Service Corps approved site. They need to have loans that are eligible loans from their educational expenses, and then they need to be licensed to practice in the state where their employer site is located. Currently, to become a National Service Corps approved site, it's a two-step process. The site would need to apply during a site application window to become a National Service Corps approved site, and then usually, like in the following spring, the provider can apply for loan repayment. So right now, the National Service Corps, their site approval application process is open on the National Service Corps website. So if you are interested in becoming a National Service Corps approved site, I highly encourage you to go to the National Service Corps website and start an application. Those applications are due November 1st, and you will most likely find out by the end of the year if you receive approval for your National Service Corps site. And then if you have any clinicians that are working at your site at that time that need loan repayment, they would be able to apply in the spring loan repayment cycle. So just keep that in mind, that that is available to sites that meet the requirements for that. Going on, the eligible disciplines for National Service Corps is very broad. You can be a physician, physician assistant, nurse practitioner, midwife, dentist, dental hygienist, psychiatrist, psychologist, licensed clinical social worker, psychiatric nurse specialist, marriage and family therapist, and licensed professional counselor. And these practitioners can apply through National Service Corps. Dwayne, I'm sorry, can you go to the next slide?
No worries, sorry.
So, like I said, for the practitioners to apply, that will open up sometime in the spring, and they can review the application and program guidance once that's posted. So for clinicians that are either working at an NHSC approved site, they can just go and apply, or for clinicians maybe fresh out of school, they can go to the NHSC jobs website and look for an approved site, which is a good kind of tool. If you are a National Service Corps approved site, you can post your site on the NHSC jobs website. So when clinicians are looking, they will see your site. And then the clinician will go apply online at nhsc.hrsa.gov/loan repayment. So, Dwayne, I think I might actually want to stop here and see if there's any questions, since this is really the bulk of the presentation, if that's okay.
Sure, that's just fine. So it's open to everybody. Any questions that folks have about the loan requirement, the loan repayment program, which Christina has been talking about so far. Also, any questions around how to apply right now in our state. So it's open to everybody. Any questions out there?
Yes, I have a question.
Yes, ma'am.
Dr. Sandra Garbely. I work at a HRSA the site at Federal Qualified Health Center in Maryland, and I was actually a loan repayment recipient back in 95 to 2000, and then I went into state-funded sites and helped open them, but now I'm back with a Federally Qualified Health Center, a different one in Maryland, and I believe that we have other providers here that have loan repayment. It is a National Health Service Corps site. Is there any way, because I do have some loans still left, of reapplying again after already being a recipient?
So I know that F2HCs are automatic National Service Corps approved sites. I don't know. I believe if you still have loans with the National Service Corps, you are still eligible. So they will let you continue to apply for an unlimited number of years as long as you still have loans.
Okay. Thank you.
So that application cycle will be open in the springtime sometime. I don't have the exact dates, but that may be something you want to consider.
Okay. Thank you.
Any other questions?
Other questions out there?
Okay, I guess we can move on.
Okay, we'll move on.
So the National Service Corps Scholarship Program, next slide please, Vane, includes payment of tuition and required fees, some other tax-free educational costs, and a monthly living stipend. So this is a scholarship that you get while you're in school, and as we can go on to the next slide, it's for the years of support equals a year of service. So if you choose to get a scholarship for 4 years during your school, you would have to serve 4 years in a shortage area in your field at an eligible site to pay back. Well, you don't really pay back your scholarship, but you would just fulfill your service obligation for the scholarship that you received while you were in school. As we can see on the next slide, scholars can choose where they serve from a list of nearly 14,000 NHSC sites across the United States. And I don't know the exact number of National Service Corps sites we have here in Maryland, but I know that we get a frequent amount of site applications. I think last year we had almost 70 approved applications come through in Maryland, so that's a significant amount. So there are many approved sites here in our state. To be eligible for the National Service Corps Scholarship Program, again, you must be a U.S. citizen or national, and you must be a full-time student pursuing a degree in one of the following programs. So this is a little less broad than the National Service Corps loan repayment, but it's still a great way for students to get a scholarship and give back to the community once they're done their education. And this is something that I try to tell the professional schools about more often than, you know, a FQHC or a health clinic, because generally they're recruiting physicians that are already complete at school, but it's still a good program to know about. And again, the application, the practitioner would just review the application guidance, and then they would apply through the National Service Corps website. The Student to Service Loan Repayment Program, which is actually open right now until November 14th. Again, this is another loan repayment program this is actually only for physicians, and they offer up to $120,000 in tax-free loan repayment for 3 years of full-time or 6 years of half-time service, and loan repayment begins during residency. So these providers will work in an underserved area for either 3 to 6 years, and then they will start getting their loans repaid. And they would have to be working, obviously, again, in an eligible site. So the eligibility requirements for this program are, again, you must be a U.S. citizen or national. You must be full-time in the last year of medical school pursuing a degree as an MD or a DO, and then you must be planning to complete a primary care medical residency in one of the following approved specialty types, and you must have unpaid loans. So that's really how that program works, and then they serve their time after after the residency program. And again, that program's open right now, and I've let some of the local schools know about that program. And then again, for applying, the provider would just go on to National Service Corps website and apply online. There are some resources that the National Service Corps has put out to keep everyone up to date. They have a Facebook page, a Twitter page. They have some videos on YouTube, and then they also have some hotlines that are available for anyone that's looking for any sort of technical assistance. But my office is actually here also to provide technical assistance. That's sort of one of our functions here in the PCO, is to provide technical assistance to applicants and to sites who may need help, applying to these programs or have questions about them. Unfortunately, I couldn't stick my information into this slide, but Dwayne would be happy to probably send you an email and share that at the end, or if, I get all of your email addresses of the participants, I'm happy to follow up with you if you have any further questions about the National Health Service Corps.
We'll go ahead and send Christina's information out to everybody that's on the call today. But if anybody has any other questions of Christina at this time, this would be a great time to ask her a few additional questions, if there are any. All right, sounds like you guys all got a lot of good information and got your questions already answered during the presentation. Any other questions or anything that you want to share? One last thought, Christina, on your side.
No, I just want to thank everyone for participating today, and, in the spirit of National Service Corps Community Day, maybe you can go visit the website and continue to learn more about National Service Corps if you get some free time. But I do think it is a great program, and, the PCO and the PCA, we're both here to really help, provide any assistance to get you to not only have providers, but to also help retain them. So, we're here. I'm here to help, and I'm sure Dwayne is too. So thank you so much for taking the time out of your day to participate in this webinar. And
thank you, everybody. And we did record the webinar, so it'll be up on our website later on this week.
Thanks,
Wayne. Okay, thank you.
Christina, thank you, Wayne.
Everybody, have a great day. Bye-bye.
Bye-bye.
Bye.
Bye.